Nutrition science, nutrition during pregnancy and lactation, exercising during pregnancy. Exercising during pregnancy can promote the health of both the mother and the baby. According to the American College of Obstetricians and Gynecologists, regular exercise in pregnancy can reduce back pain, ease constipation, promote healthy weight gain, improve overall fitness, and help with weight loss after the baby is born. It may also decrease the risk of gestational diabetes, preeclampsia, and cesarean delivery. The ACOG recommends that pregnant women get at least 150 minutes of moderate intensity aerobic activity each week. Most forms of exercise are safe in pregnancy. Women should consult their healthcare provider for individualized advice about exercising while pregnant. Macronutrient requirements. The acceptable macronutrient distributions, ranges, or AMDR for macronutrients are the same for all healthy adults, pregnant or not, with about 45 to 65% of calories coming from carbohydrates, 20 to 35% from fats, and 10 to 35% from protein. As energy intake increases, a pregnant woman needs more of each of these macronutrients. The recommended daily allowance, or RDA, for carbohydrates increases from 130 grams per day for non-pregnant adults to 175 grams per day for pregnant women. This level of carbohydrate intake provides energy for fetal development and ensures adequate glucose for both the mother's and the fetus's brain. The recommended fiber intake in pregnancy, expressed as NAI, is the same for all adults: 14 grams of fiber per 1,000 calories consumed. As caloric intake increases during pregnancy, so should fiber intake, emphasizing the importance of choosing whole food sources of carbohydrates. Additional protein is also needed during pregnancy. Protein builds muscle and other tissues, enzymes, antibodies, and hormones in both the mother and the fetus, as well as supporting increased blood volume and the production of amniotic fluid. The RDA for protein during pregnancy is 1.1 grams per kilogram body weight per day, coming to about 71 grams per day for an average woman, roughly 25 grams more than needed for pregnancy. There is not a specific RDA for fat during pregnancy. Fats should continue to make up 25 to 35% of daily caloric intake, providing energy and essential fatty acids, linoleic acid and alpha-linolenic acid, as well as helping with fat-soluble vitamin absorption. The omega-3 polyunsaturated fatty acids, DHA and EPA, become more important during pregnancy and lactation because they are essential for brain and eye development of the fetus and infant. The dietary guidelines for Americans recommend that pregnant women consume 8 to 12 ounces of seafood each week, in part to provide omega-3 fatty acids. Fish with high levels of mercury should be avoided. These include king mackerel, marlin, orange roughy, shark, swordfish, tilefish, and big eye tuna. Advice from the EPA and FDA about choosing safe fish to consume during pregnancy and breastfeeding. Consider the following recommendations for healthy eating during pregnancy as summarized in the My Pregnancy Plate graphic. Choose large portions of a variety of non-starchy vegetables such as leafy greens, broccoli, carrots, bell peppers, tomatoes, mushrooms, and cabbage. Choose a variety of whole fruits, limiting juice and dried fruit. Aim for 2 to 3 servings of non-fat or 1% milk or yogurt, unsweetened or slightly sweetened. Choose protein sources like poultry, beans, nuts, eggs, tofu, and cheese. Aim for 8 to 12 ounces of low-mercury seafood each week. Choose fiber-rich sources of carbohydrates, including whole grains, legumes, and starchy vegetables, such as sweet potatoes and squash. Drink mainly water, decaf coffee, or tea. The mineral and vitamin requirements. The physiological demands of pregnancy increase the requirements for many vitamins and minerals. These requirements can be met from food sources, but obstetricians also generally recommend that women take a prenatal supplement while trying to conceive and during pregnancy. This ensures that nutrient requirements are met, while also providing a little peace of mind if pregnancy-related nausea and vomiting limit dietary variety and quality. Among the micronutrients, folate, iron, and iodine deserve a special mention. Folate is essential for the growth and specialization of cells of the central nervous system. Mothers who are folate deficient during pregnancy have a higher risk of having a baby with a neural tube birth defect, such as spina bifida. Folic acid fortification of grains in the U.S. has helped to raise folate intake in the general population and has reduced the incidence of neural tube defects. However, dietary intake is often not adequate to meet the requirement of 600 milligrams of folate per day in pregnancy, and the American College of Obstetricians and Gynecologists recommends that pregnant women take an additional 400 milligrams of folic acid each day, an amount usually included in prenatal supplements. The neural tube closes by day 28 of pregnancy, before a woman may realize she is pregnant, so it's important to consume adequate folate while trying to conceive. Because about 45% of pregnancies in the U.S. are unplanned, a folic acid supplement is a good idea for anyone who may become pregnant. Iron intake is important because of the increase in blood volume during pregnancy. Iron is an essential component of hemoglobin, the protein responsible for oxygen transport in blood. So adequate iron intake supports oxygen delivery to both maternal and fetal tissues. Good dietary sources of iron include meat, poultry, seafood, nuts, legumes, and fortified or whole grain cereals. Iron should also be included in a prenatal supplement or taken separately. Iodine is essential for fetal brain development, but recent data suggests that many pregnant women in the U.S. do not consume enough iodine to meet their increased requirement. Much of the iodine in the typical American diet comes from dairy products and iodinized salt. However, iodine intake in the U.S. has declined in recent decades as more people watch their intake of table salt and or switch to kosher or sea salt, which aren't iodized. In addition, processed foods are generally made with non-iodized salt, and the intake of processed foods has increased. Meanwhile, the popularity of dairy products has declined. Most people in the U.S. still consume enough iodine to meet their requirement, but pregnant women may be at risk for iodine deficiency because of their increased need for this mineral. Iodine deficiency during pregnancy can cause miscarriage, stillbirth, and major neurodevelopmental deficits and growth retardation in the fetus. Unfortunately, many prenatal vitamins do not contain iodine, so it's worth checking the label to ensure that iodine is included. Nutrition science, nutrition during pregnancy and lactation, exercising during pregnancy. Exercising during pregnancy can promote the health of both the mother and the baby. According to the American College of Obstetricians and Gynecologists, regular exercise in pregnancy can reduce back pain, ease constipation, promote healthy weight gain, improve overall fitness, and help with weight loss after the baby is born. It may also decrease the risk of gestational diabetes, preeclampsia, and cesarean delivery. The ACOG recommends that pregnant women get at least 150 minutes of moderate intensity aerobic activity each week. Most forms of exercise are safe in pregnancy. Women should consult their healthcare provider for individualized advice about exercising while pregnant.